Hello, this is Professor Tiam, Unit 7, Module 1, Growth and Development of Early Childhood. For this module, you'll have 4 sub-competencies covering the physiologic changes in early childhood, psychosocial development, language development, and play, as well as the nursing process. This covers your Ricky textbook, Chapter 26. During the toddler and preschool years, physical growth slows compared to infancy, but continues at a steady rate. Because growth is slower, toddlers often have a decreased appetite, which is a normal finding. Development continues to follow in an orderly and sequential pattern. Toddlers demonstrate a characteristic toddler gait, which includes a wide-based stance and their toes pointing forward. This reflects developing balance and coordination. As children move into the preschool years, their bodies become more slender and proportional. The legs lengthen, posture becomes more upright, and the pot belly, seen in toddlerhood, gradually disappears. At the same time, children become more agile and coordinated. Growth during this period is pretty predictable. Preschoolers gain about 4 to 5 pounds, so that's 1.8 to 2.3 kilograms per year, and the height increases about 2.5 to 3 inches. That's 6.35 to 7.62 centimeters annually. So from a sensory standpoint, toddlers explore their environment using all of their senses. They lack the complete taste discrimination, so this increases the risk for accidental ingestion of toxic substances, making supervision extremely important. Their vision improves. Hearing reaches an adult level. Remember that hearing is intact at birth, but now it's maturing and reaching adult levels. This supports their language development as well as learning. As motor skills develop and are practiced, the toddler's large muscle groups become stronger. So early walkers display a characteristic toddler gait, which is wide-based with their feet pointed forward. Walking at this stage is unsteady with some swaying from side to side and a forward-leaning posture, almost looking as if the child is about to fall. Toddlers do fall frequently, but typically they protect themselves with their hands outstretched. This is known as the parachute reflex. Gait becomes smoother and the feet become closer together. So they move closer together when they walk. By 3 years of age, most children walk with a mature heel-to-toe pattern similar to how adults walk. Toddlers often use physical actions such as running, jumping, and hitting to express emotions, as their verbal expression is still developing. The expected gross motor milestones include running and kicking a ball by about 24 months, and jumping with both feet by 30 months. By age 3, toddlers should be able to walk up and down stairs, while more complex skills such as pedaling a tricycle and skipping develop later in the preschool years. Fine motor skills continue to improve as well during these toddler years. They progress from feeding themselves finger foods around 15 months to using a spoon by about 24 months and a fork by age 3. They also develop the ability to stack blocks, string beads, turn pages, and eventually copy a circle. Refinement of fine motor skills depends on adequate vision and eye-hand coordination. This allows for precise control of the fingers, hand, and wrist for tasks such as puzzles or buttoning their clothing, as well as zipping. By 3 years old, children can move each finger independently, and they begin holding their utensils better, such as using the fork. They can grasp crayons with a more mature grasp, using the thumb on one side and the fingers on the other. They can scribble freely copy a circle, trace simple shapes, and feed themselves with minimal spilling of the food. So, over the next 2 years, these fine motor skills continue to strengthen and become more precise. By age 5, most children can print some letters and cut with scissors more accurately. They can begin learning to tie their shoelaces around this age also. Please look at this table for the preschool motor skill development as well as the previous one for the toddler motor skill development. So please review both of these tables and remember their milestones at certain ages. Toddlers, so that's that age between 1 to 3 years old, are in Erikson's developmental stage of autonomy versus shame and doubt. During this time, their main developmental task is gaining a sense of self-mastery and independence. They want to do things on their own and begin to see themselves as separate from their parents. Several normal behaviors are seen during this stage, such as negativism, which is very common. Toddlers will frequently say no as a way to assert control, even if they actually mean yes. They can also be very egocentric, so that means they're focused on themselves and they have difficulty seeing things from another person's perspective. So this contributes to their emotional ups and downs. So their moods shift quickly from happy to crying or having a tantrum when limits are set. Toddlers often rely on consistent routines to feel secure. Cognitively, toddlers learn through imitation. They may copy tasks they observed days earlier, such as pretending to sweep or talk on the phone, showing early memory and learning. So from a nursing perspective, supporting autonomy is important. During assessments, we want to use minimal physical contact at first to help build trust. We want to encourage parents to allow toddlers to try new skills independently, such as feeding or dressing themselves, because this strengthens the toddler's confidence and supports their healthy development. Preschoolers, that's the age between 3 to 6 years old, now are in Erikson's developmental stage of initiative versus guilt. During this stage, children begin to take initiative by planning activities, making up games, and becoming more inquisitive about the world around them. They're eager to learn, they want to be helpful, and often they try to please their parents and authority figures. When they feel they've done something wrong, they may begin to experience guilt. Socially, preschoolers transition from parallel play from their toddlerhood years into cooperative play. They begin forming friendships, learning to share, and working with others. This is also when they start developing a more clear sense of identity, including self-concept, gender identity, and a basic understanding of themselves as individuals. Cognitively, magical thinking is common, especially around age 5. Children may believe their thoughts can cause events to happen. Fantasy play is very active at this stage, and having an imaginary friend is a normal and healthy part of development. Sexual curiosity is also typical in preschoolers. They become more interested in their body differences and the reproductive process. They explore their body parts more as part of a normal development. So parents should respond with simple, honest explanations using correct anatomical terms without shame or punishment. Language development during the toddler and preschool years is rapid. Receptive language is the ability to understand words, and this develops faster than expressive language, which is the ability for the toddler to speak. So this is why toddlers often understand far more than they can say. Toddlers usually use only essential words, such as want cookie, By age 2, most toddlers have a vocabulary of about 50 words. The repetition of words often happen without fully understanding what those words are. So that's common in younger toddlers, and it's a normal part of their development. Reading to toddlers daily is very important because it supports vocabulary growth and language comprehension. As children move into the preschool years, language skills expand quickly. By around age 5, vocabulary can grow to about 2,100 words. Preschoolers begin speaking in full sentences and can tell simple stories. During this time, some stuttering or saying words not fluently may occur between about 3 years to 6 years old as children work on their language fluency. This is temporary and it resolves by about 8 years old. Children exposed to more than one language may mix languages in the same sentence, and this is normal in bilingual language development. It's not a sign of delay. In clinical practice, language development is often screened using the Denver Developmental Screening Test. It also assesses gross motor, fine motor, and language development. So the Denver Developmental Screening Test is not just for language, but also gross and fine motor skills. It doesn't test intelligence, though. It's more of the language development in a child. Play is the primary socializing activity for young children. It's essential for their learning, their creativity, as well as their development. Play supports their motor skills, their language growth, their imagination, and their social interaction. Socially, toddlers engage in what we call parallel play. This is when they play alongside others, but not truly with them. They often resist sharing their toys because they see the toys as extensions of themselves. For toddlers, play is mostly focused on exploration and manipulation. They enjoy toys they can hold or stack or bang or carry around. So this is blocks, dolls, drums, and safe household items. As children move into the preschool years, play becomes more social and imaginative. Preschoolers begin transitioning into cooperative play, where they interact more, they form early friendships, and they start learning to share and take turns with their toys. They're highly imaginative and often engage in dramatic or make-believe play, including pretending to have imaginary friends. So this type of play supports initiative, their creativity, as well as their social development. Appropriate toys for the preschool age encourages their creativity and builds up their skill. So there's like dress-up items. They like to play make-believe and dress up. They often will use crayons better to help develop their fine motor skills and self-expression. So that's a very good appropriate toy for a preschooler. They will play with puzzles that support problem solving and tricycles, which can help promote their coordination and their gross motor development as well. Now we'll jump into Unit 7, Module 2, Health Promotion During Early Childhood. This module covers the same textbook chapters as the previous module. We're going to identify health promotion activities related to various topics, including toilet training, temper tantrums. We're going to talk about nutrition, sleep, play, dental health, abuse, and many more topics as listed under these sub-competencies here. Toilet training typically begins around 18 to 24 months of age. The timing correlates with the spinal cord development, which is called myelination of the spinal cord. This allows toddlers to gain better sphincter control. There are several other signs that a child is ready for toilet training, such as following simple instructions, the ability to stay dry for several hours, pull their clothing up and down by themselves, and begin to understand what is being asked of them. There are a few other important nursing priorities to teach parents regarding toilet training. First, bowel control is typically achieved before bladder control, so that is a normal expectation. Parents should avoid forcing the child to sit on the toilet for long periods, as this can create frustration and resistance for the child. So temper tantrums are another normal part of development. It's a child's way of expressing independence and frustration. So the key teaching point is to make sure the child is safe when they're having tantrums. Otherwise, parents should ignore the behavior so it doesn't become reinforced. Regression is also common, especially when a child is stressed, as in the birth of a new sibling or hospitalization. This is usually temporary and is a normal coping response. When helping toddlers cope with separation from their parents, it's helpful to use concrete time references when they ask, "When are my parents coming back?" Instead of saying 3 o'clock they'll be back or 1 o'clock. Say something like, "Your parents will be back after you take your nap," since young children don't really understand clock time. A nap will also be good for the child, so this is a useful way to get them to nap while parents are away. It's also a very good nursing intervention in the hospital, but also important for daycare facilities. So when parents are choosing daycare facilities, they should consider that the teachers and the staff have this knowledge of normal developmental behaviors, including these and the ones we'll talk about more on this lecture. Another health promotion topic common in preschool and kindergarten age children is fear. So children have very vivid imaginations, which often leads to common fears. They may be afraid of the dark, monsters or loud noises, monsters in their bed. So these fears are a normal part of development. So it's also important to understand the difference between nightmares and night terrors. Nightmares occur in the second half of the night, and the child wakes up and can be comforted, while night terrors happen earlier in the night, shortly after falling asleep, and the child may appear very upset, but is often difficult to awake and not fully responsive. So this is sometimes brought up with parents when they're concerned about their child sleeping. Speech development is another area to discuss. Stuttering or disfluency is common between ages 3 and 6 as children's vocabulary rapidly expands. In most cases, this resolves on its own by around 8 years old. Parents should be encouraged to give the child time to speak and avoid rushing or interrupting them. So discipline is a big part of health promotion. Safety is a key issue here. So the goal of discipline is to help the child develop self-control, not to punish them. Setting clear and consistent limits helps preschoolers feel secure and understand expectations. This goes for toddlers as well. Normal nutrition patterns are an important topic in the toddler and preschool age child. It's important to understand the typical appetite changes. So we mentioned previously that toddlers have a decreased appetite. This is called physiologic anorexia, which means their appetite, it naturally decreases because their growth rate is slowing down. This is normal and doesn't mean that something is wrong. There's just food jags where a toddler prefers to eat only one food, possibly for several days. That's very common. So, from a nursing perspective, parents should be encouraged to offer a variety of healthy foods and nutritious snacks throughout the day. So, a key teaching point is to avoid forcing a child to eat if they refuse a meal. Pressuring children can lead to negative eating behaviors. Fluid limits are also important, especially we're talking about juice mostly. Juice should be limited to about 4 to 6 ounces per day. Of course, avoid soda to help prevent obesity and dental caries. Milk intake at this point is also decreased to about 16 to 24 ounces per day. Too much milk can actually interfere with iron absorption and actually lead to iron deficiency anemia. So, safety topics are essential during meal times. Families should avoid high risk choking foods like nuts, which are hard, grapes, easy to choke on, raw carrots, um, hot dogs that aren't cut up. So, children should always be supervised while eating. Toddlers need about 12 to 13 and a half hours of sleep a night, while preschoolers need about 12 hours. One of the most important nursing priorities is helping families establish consistent bedtime rituals. Predictable routines help children feel safe and secure and make it easier for them to fall asleep. Looking at play in toddlers, we want to talk about parallel play. So this means they play alongside other children but not directly with them. Toddlers are egocentric and often have a strong sense of ownership, which is why they don't really share, and you'll frequently hear them say mine all the time. So as children move into preschool years, their play becomes more social. They begin to transition to cooperative play and dramatic or make believe play. So during this stage, they start forming friendships and often enjoy pleasing others, which reflects their growing social development. Mental health in toddlers and preschoolers is a really important part of early prevention. It's very important to teach the parent that their first dental visit should occur by age 1. This helps establish a dental home early, allows for early identification of problems, and gives parents guidance on healthy oral habits. Prevention is a major focus. Families should be encouraged to provide a low cariogenic diet, which means limiting sugary, sticky foods that can increase the risk for cavities. Another important teaching point is to never put a child to bed with a bottle. When milk or juice in the bottle sits on the teeth um, overnight, it increases the risk of early childhood caries. Brushing habits should be taught early. So after age 2, children should use a pea-sized amount of fluoride toothpaste. Parents should assist with brushing by stabilizing the child's chin with one hand and brushing with the other. This helps ensure that all the surfaces of the teeth are cleaned safely and effectively, since young children don't have the coordination to brush well on their own. So the overall goal is to start healthy dental habits early, focus on prevention, and support parents in helping their child maintain good oral hygiene. Safety and injury prevention is probably one of the most important areas of health teaching for toddlers and preschoolers. So the most effective strategy, or the number one way to prevent childhood injuries, is close supervision. Nurses should always emphasize to parents that watching children closely is the best protection against accidents because injuries happen very quickly and quietly. Next is car safety. Children should remain in rear-facing car seats until at least age 2. After that, they can transition to a forward-facing seat with a harness until they reach the height and weight limits set by the manufacturer. proper car seat is a very effective way to prevent serious automobile injuries. Moving into home safety, drowning is a major risk. Parents should fence all pools, never leave child unattended near any water. That includes bathtubs, toilets, or even buckets. It only takes a small amount of water for a drowning event to occur. Poisoning is another serious concern in the home. Medications like even iron supplements, cleaners, automotive fluids should always be stored in locked cabinets and kept out of reach. Many childhood poisonings happen because children can easily access these substances. Aspiration and choking prevention is very critical. Children should not have access to small toys or objects either that could be swallowed easily. This is especially important teaching for a child. So there have been cases where children need procedures like bronchoscopies to remove the foreign object. So we want to educate the parent thoroughly about preventing repeat episodes from happening before they get discharged, because that is, very critical that they have that procedure, and it is, very fortunate that the child was able to survive and get discharged home. So we do not want that to happen again. Finally, tobacco smoke exposure is another important health risk. It increases their risk for respiratory infections, middle ear problems in children as well. So families should be encouraged to keep the child's environment smoke-free. So there are several health education topics that we reviewed, and still more that are very important. There's also several community resources that support child development and family wellness. So there are red flag concerns that the nurse should monitor for, which is a developmental delay. So examples include a child not walking perhaps by 18 months, not using two-word sentences by around 2 years old. So all of the developmental milestones that we reviewed, lags in those milestones is a concern for developmental delays. So another concern is when children have missed their well child visits or have not had consistent medical care. So that's another red flag. Next is a community resource. The Poison Control Center is a very important resource for families, so they should be taught to call immediately if a child ingests medication, chemicals, household products. The number is 1-800-222-1222, very easy to remember. They also have a website, and this should actually be on the fridge for parents because it's very important and a big safety feature. They are available 24 hours a day. There's also the WIC program, which supports pregnant women, infants, and young children by providing healthy foods, formula, and nutritional education. They also help monitor growth and support healthy development. Reach Out and Read is another valuable program which encourages parents to read daily to their children to support their language and cognitive development. Providers often give books to families during well child visits as well, sometimes, so we can provide those if it's available. Maternal health is critical as well. Nurses should screen for maternal depression because it can affect bonding, attachment, and a child's cognitive development. When concerns are identified, referrals and support should be offered. So we talked about the child earlier that has missed their well child visits or has not had consistent medical care, but I just wanted to reiterate that perhaps a toddler has not been seen in years. So the priority here is to update all of their vaccinations, and we want to reconnect the child with routine health services. We did discuss on previous lectures how prevalent rotavirus was for children. So getting this vaccine as early as possible is very important. There are key points related to recognizing and responding to child neglect and abuse. Starting with assessment, the nurse should always be alert for injuries that don't match the child's developmental age. For example, a non-mobile infant should not have bruises or fractures if they're not running and walking around. That type of injury is a major red flag. Another concerning find is symmetrical burns, such as burns on both hands or both feet or the buttocks as if they were submerged. These patterns aren't typical of accidental injury and should raise suspicion. There's also behavioral warning signs. Some children may protect the caregiver or seem fearful to speak. Anxiety might be evident, withdrawal, or a strong fear of going home. These behaviors can signal that the child doesn't feel safe. When considering risk factors, certain children may be more vulnerable, like children with disability or with difficult temperaments, or children who are perceived as unwanted. Social stressors in the home can also increase risk of abuse. Looking at abuser patterns, one important sign is when a caregiver gives inconsistent explanations for injuries. In cases of sexual abuse, the abuser may pressure their child to keep secrets, which can make disclosure more difficult. In terms of priority nursing action, safety is always the first priority. If abuse is suspected, the nurse's responsibility is to make sure the child is safe, first and foremost. Then remove the child from immediate danger whenever possible and allow reporting protocols following. Make sure the child is safe and remove them from danger first. For discipline education, as we talked about, we want to discourage physical punishment and spanking because this will lead to fear and aggression. So instead, we can use timeouts, and we'll teach this to the parent. A healthier approach for discipline is using timeout with a general guideline of 1 minute per year of the child's age. So finally, the overall nursing goal is to promote family functioning and support safe parenting skills through family-centered care.